And it is now my great pleasure to welcome you to this last, but absolutely not least, keynote speech. Our speaker for the next 30 minutes is no one less than Margrethe Vestager. Margrethe has been a Danish politician for many years. She has also been a minister in several ministries, and she has been the party leader of the Social Liberal Party in Denmark, happens to be my own party. Now, Margrethe is being, I think I can say, highly qualified commissioner in the European Commission. You are one of 3 executive vice presidents of the Commission. You are the Commissioner of Competition, and you have the special responsibility of chairing the Commissioners Group on the Europe Fit for the Digital Age. We are looking very much forward to hear about all this. The theme of this conference is breaking down barriers. And I think it's true to say that you have indeed broken down many barriers in order to reach your goals and the things that you have been fighting for as a politician and a commissioner. So I think we are many who are looking forward to learn from you. And I will now hand over the screen to you. Welcome, Margrethe.
Well, thank you very much. It's always and still challenging to make things work remotely, but I think that you hear me. And I do hope that you hear me loud and clear. Thank you very much for the invitation to speak here today. If things were different at this point in time, I would try to persuade you that Copenhagen is a beautiful city and that you should make the most of it. Try to get the biking experience. Maybe if you are that kind of person, have a dip in the harbor, which is clean and quite delicious all time of year. Nevertheless, we cannot be together physically, but we can still be together because we share a very important interest, not only for ourselves, but also for our fellow citizens and fellow professionals. So I would like to thank the organizers really sincerely, both the Institute for Healthcare Improvements and the BMJ. I think, or I understand, that this has been a very successful event, and I think it's an example of making the best out of a very difficult situation, because it is indeed a very difficult situation that we're in. While that is obviously a tragedy in so many ways, for people who lose their lives, for loved ones who loses out, for all the value that is being lost, I think there are also important learnings that we should take from this. Because now we talk about how important it is to invest and improve our healthcare systems, that it is very important to ensure adequate spare capacity, promote international exchange of best practices, how we must make the best use of technology to guarantee that we can offer citizens the best possible healthcare in the face of tight public budgets and the population aging. I don't think anyone disagrees with any of that these days. But the thing is that when the world runs smoothly, well, we have a tendency to take this for granted, as this came sort of naturally. But the problem is it doesn't come naturally. And the risk is that the political focus will shift and necessary reforms will be delayed or maybe even forgotten as we move on. And the COVID crisis, for all its costs, at least reminds us that what you have been discussing is not just important. It is the foundation that we all built on, because everything starts with good health. If you don't have good health, well, that is your prime occupation. And that, I think that realization opens a window for us to make important changes as to how we organize ourselves, how we implement our healthcare policy. And not only can we improve millions of lives, we can also save millions of lives. So let me start with some of the things I've learned from the crisis so far. The first thing is being prepared. when the virus struck, there was a race to put in place systems to respond effectively at all levels. That meant tangible things as ensuring sufficient supply of personal protective equipment, access to PCR tests. It also meant the intangibles, like administrative procedures to coordinate between different national administrations, regional authorities, local authorities, making the link between those who set the guidelines and those who actually do deliver on ground. It also meant improving coordination between member states. Next week, we will propose a new European framework for preparedness, surveillance, risk assessment, early warning, and coordinated responses. The package will expand the mandates of both the European Centre for Disease Control and Prevention and the European Medicines Agency. This will allow them to play a key role in tackling future crises in a more effective manner. It will also strengthen the coordination cross-border between health authorities. On top of this, we're also working on a new pharmaceutical strategy. That is a strategy for Europe, and the point is to address, I think, basically long-standing challenges. And that includes protecting our strategic interests when it comes to supply of medicines, in particular medicines that are high in demand when you have a sudden crisis. And we will come forward with these proposals later this month. Of course, and I think we should take that for granted, in the health fair, the responsibility, the competences, they remain fundamentally with member states, and it should stay like this. At the same time, I think we should use this COVID experience to learn how we coordinate better and what is needed at the European level to make our health systems, to make our health policies stronger, more resilient, more implementable. The second lesson is to have sufficient and well-funded healthcare. I think that is the second lesson. The crisis have impacted countries very differently. It still does. And big part of that was or had to do with the capacity of various national healthcare systems. How those systems are funded, how they are organized, well, that is a question of political priorities. But it's also a question of having the resources to pay for healthcare. It's a question of sound economic policies. And that also means finding the right balance between mitigating the spread of the virus and protecting the economic sectors which provide those resources in forms of tax revenue, while at the same time having a strong healthcare system that can endorse these, because these two things, they go together, strong health and strong economic performance. Thirdly, COVID has taught us something important about our values. What is basically an essential worker? I really like the term because it raises a very important question. In that order, what and whom do we rely on in our day-to-day survival? As we saw, many of the essential workers, they were not the best paid workers. Yet they put themselves at risks in hospitals, in supermarkets, in care homes. And you couldn't help noticing that the majority of these essential workers, they're women. Valuing their essential work is therefore also a question of addressing the gender pay gap. That's a pay gap that stubbornly exists in all member states. And that is why the Commission's gender equality strategy is important. It was developed before the crisis, but it remains more important than ever. Last but not least, the pandemic showed the importance of digitization. Also how much it can mean, if done properly, for the strength of the economy and public service. And let me dwell a bit more on exactly this point of digitization. Because what we saw was that the pandemic accelerated what was ongoing already, the transformation, and that also happened in the health sector. Changes that were taking years to materialize, well, they now happen in a matter of months. The faster pace of transition, of course, that puts a pressure on us to manage the transition in a proper way. Obviously, that's as much easier said than done. Health systems, they are incredibly complex. Very often they are fragmented. It's difficult to coordinate, to make different authorities be coordinated for the sake of patients. So joint efforts are needed, not only to overcome existing barriers, but also to make sure that the protocols are in place to avoid new ones. Because the digitization of our system should happen in parallel to breaking then barriers, and to make sure that we minimize fragmentation instead of creating a new one. Which is why healthcare and digitization is a priority under the new European Recovery Plan. That plan has, as its heart, a funding facility worth 672 billion euros. Member states can tap this funding through flagship areas, one of which, we call it the Modernize flagship, is dedicated to digitization in healthcare and other public services. When systems are integrated across care providers, they can be a great tool for providers to collaborate more efficiently. Better use of health data supports research, supports innovation, and that keeps Europe where we belong, in the frontier of next generation healthcare, in that innovation pace. This is where we should be. But in order to be there, we also need to invest in the right regulatory approach. After all, one of the obstacles to making best use of digital in healthcare is patient acceptance. And part of that is trust. If you don't trust it, you don't use it, and in particular not in areas where you have a sense that this is a matter of life and death. And this is why we want the pooling of healthcare to be secure, and crucially, patients maintain control over their data. And the starting point of that, of course, must be that there's a full respect of European rules, of European values. And that is why, that is what will be underpinned by a new legal framework to promote access to data. We will propose that quite soon. And next year, we will follow up with a sector-specific proposal for sort of the legal framework for a European health data space. Its purpose will be to make sure that the originators of health data, that they are collected and recorded in a consistent way. This will keep the competition in the data market fair. It will also give patients and others who produce data the power over their health data. We want the approach to build on a very high degree of data protection, a data protection level that we have already now achieved in Europe, and where we obviously should not sell out while we're in the process of making this a real thing. You all know the GDPR. You all know the debates about e-privacy directive. And the thing about data and the reason why we put such an effort is obviously that data will enable new technologies like artificial intelligence to be used so much more in many areas in the economy, and that includes healthcare, obviously. AI has the potential really to change things, to enable us to do new ways, promote new ways of treatment, to personalize the care for the individual patient, to develop new healthcare devices, and obviously to provide better and more effective medicines. And the Union can help us to build a strong and reliable data feed that artificial intelligence can depend on by linking different data sources across Europe so that we get one data set that is accessible. I think a good example of that is the 1+ million genomes initiative that was launched 2018. This is a collaboration between 22 member states and Norway to reach 1 million sequenced genomes by 2022. And also, the European Union adds clear value by facilitating collaboration. Another contribution, of course, is to set the right regulatory framework, one that respects European rights and European values. Whether AI is used to steer the laser that diagnoses brain tumor or to steer self-driving cars, our position is the same. There's no place in Europe for algorithms that violate our privacy, erode our rights, or reinforce discrimination. In February, we published a white paper on artificial intelligence, accompanied with a working paper, a report on its safety and liability implication. And the ultimate goal of the work that we do right now is to make sure that we have an approach to artificial intelligence that's proportionate, so that we set up a framework that at the same time will guide innovators towards reliable and people-friendly outcomes. In the long run, building that trust, making sure that people can see that it can be explained what is ongoing, that things that risk of undermining your individual integrity, that is dealt with. That opens doors for innovation, for artificial intelligence to be used in full, because it is a real thing that we live in society where our integrity is protected and is the starting point. That same logic, well, that appears in also the specific things that we have done when it comes to contract tracing, warning applications. We have established a European toolbox, guidance on data protection for contract tracing. And that has been dealing with issues of scope, like only collect the data that is strictly necessary, and security, state-of-the-art encryption, which is a thing that we will have to talk much more about in order to provide people with the trust that this is actually safe. The thing is, we also need to make sure that national systems can speak with one another. And the goal is to be able to keep European borders as open as possible without undermining our efforts to come to grips with new infections. And just last month, the European Federated Gateway Services went live, enabling warning to be sent between different national apps. So to conclude, when before I spoke to you, I took out my mask. We're not in a normal situation. People are not able to do what they want to do. There are restrictions. There are protective measures. There is a crisis. The pandemic is far from over. And eventually, when it ends, I'm absolutely sure that researchers in many areas, healthcare, economics, psychology, will spend years going over the data, figuring out what did we do right, what did we do wrong, also to help us cope with corona PTSD, with sort of the mental reaction to having, as societies, as a planet, been into this extreme situation for a prolonged period of time. The thing is, there's more to that than the crisis. There's also something that we can do to change. There are opportunities here because we learn. And there is a chance to make real progress on the big challenges that we have ahead of us. Things like climate change, social justice, bridging the digital divide. And that is an opportunity to harness all the knowledge that you have been discussing this week in order to break down barriers, to join what is fragmented, to overcome what is held apart, in order to do the fundamentals, to make sure that we can deliver better healthcare, that we can innovate, because it all starts with one fundamental thing, being in good health. Then we can achieve almost whatever we want to do. Thank you very much.
Thank you very much to Margrethe Vestager for that excellent keynote speech. Unfortunately, we don't have time to take questions. Margrethe is going on to another engagement, but we'd just like to say thank you on behalf of everyone here for a fantastic session. So thank you all, and we hope to see you at other sessions coming up later in the day. Thank you and goodbye.